Hi, I'm Dr. Namita. Today we'll talk about certain anorectal conditions and when you should visit a doctor when you face those. So firstly, people with anorectal conditions have certain similar symptoms like pain at the anal region, bleeding per rectum. Now these conditions can be in different diseases of the anal region. For example, people have bleeding in piles, also people have bleeding when they have fissures. So it is very important to know that this bleeding is occurring from where. For that you need to visit an anorectal surgeon who will check you per rectally, and then we understand if the patient is suffering from a fissure or piles, and accordingly there are treatments for the same. Certain times this pain is also associated with fever and chills. Sometimes instead of blood there is pus or certain watery discharge that comes from the anal region. This happens when there is any abscess formation near the anal region or also in cases of fistulas. Also, one of the symptoms is certain patients figure out that there is some tissue or mass that comes out of the anal region. Now sometimes this tissue or mass goes inside on its own, or then the patient has to push it inside. Now in such cases it is very important to see a doctor. So the symptoms that we have seen till now are basically pain, swelling, bleeding at the anal region, pus discharge and certain tissue that comes out of the anal region. So if you face these symptoms and they are persistent, they have not stopped, then you should definitely see a proctologist or an anorectal surgeon. So at Healing Hands Clinic, we have expert proctologists, also female proctologists for female patients. So if you are facing any of these symptoms, definitely you can give a call on the below number or you can visit Healing Hands Clinic. Thank you.